Hi, welcome to Community Connections, brought to you by the Greater Kanawha Valley Foundation. This is a show showcasing community involvement, and I have two guests today that I think you're going to learn a lot from. I know I sure did speaking with them. Today we're going to talk about the Kanawha County Dental Health Council, and my guests are Dr. Michelle Paterno and Dental Assistant Felicity Davis. Welcome to the show, guys.
Thank you. Thank you for having us. Thank you.
I'm so glad you're here. You have so much information to share with us, and it's fascinating what you do and how you're helping the community, and I can't wait to hear more about it.
Thank you. It's always something that we love to share. It always is.
Yeah, so tell me about the Dental Council.
So basically, we are a nonprofit located within Kanawha County Schools, and we provide comprehensive dental services for children or adults enrolled in Kanawha County Schools that have no insurance, or they can have CHIPS or Medicaid, and we see them for free. There is no charge for the services we provide.
Dental service free.
Correct. Correct.
Wow.
Yes.
And that's for Kanawha County students.
For Kanawha County students. So any student that is enrolled in Kanawha County Schools, or if it is an adult student enrolled in a Kanawha County Schools program at a technical school such as Carver or Garnet, they also are eligible for our program.
Wow. And you see a lot of kids.
We do. We have the pleasure of seeing, as far as treatment goes, seeing about 1,500 children per year and providing services for them. We do comprehensive dentistry. We do everything from preventive dentistry, which are cleanings, fillings, extractions, root canals, restorative dentistry, sealants, fluoride treatments. We do it all.
So, Dr. Paterno, tell me how it works.
Okay.
If I'm a student in the school system and I need some help, how's that happen?
So every school year, at the beginning of the school year, everyone gets that beginning of the school year packet. And in that packet is our application for dental services. I'm sure every parent that has a student in Kanawha County Schools has seen our application before. So basically, we are a non-compete with the local dental providers in the Kanawha Valley. So if you have a dentist that you're currently seeing, then you just mark on that application, I have a dentist and no, I don't need your services. Or if you are interested in our services, then you indicate that on the application. When that is done, those applications are returned to the schools and they are given to our school-based dental hygienists. Those are our dental staff members who travel to all the schools in the county. They provide all the dental health education. They do all the screenings, all the kindergarten roundups, all the pre-K roundups. Those are our dental staff members that you are familiar with. Busy, very busy, yes. And so once those applications are approved, then we contact the parent or guardian and get them set up for dental services.
And so if I'm in a school that has a dental assistant but not a dental clinic, because those are in certain spots around the county.
Correct. We have 5 dental clinics kind of geographically dispersed around the county so that we can reach all the areas. Our main clinic is at Mary C. Snow Westside Elementary School, and it's a beautiful 4-chair clinic. It is our largest clinic. We also have one that serves the eastern end of the county, which is at Carver Career Center. And that is a unique clinic in itself because we do work with the dental assisting program at Carver, and it is part of their simulated workplace environment. We love being there, we love the environment, and we love being able to contribute to the education of the students in Kanawha County.
And I think we're going to talk a little bit
We'll
more
talk more about that. Yes. We have
Mm-hmm.
another clinic at Bridgeview Elementary, which serves the children in the South Charleston, Dunbar area, and it's a wonderful facility there. And we have a clinic at Elk Center, and we also have one at St. Albans High School. So.
Okay, so if I am not at one of those schools,
Correct, yeah.
and I need a little extra care that the dental hygienist in the school can't give me, what happens?
So children are brought to our clinics in 2 different ways. The parent, and this is all on the application, the parent can indicate whether they want to bring them in for dental services. So you can call and make an appointment at one of those dental facilities, and we're happy to schedule an appointment for you. Or there is an option for the children to be transported on a Kanawha County Schools school bus. And so they are under the direct supervision of the school-based dental hygienist. So, for example, if we have, 10 or 12 children from one school that all need the option of being transported by school bus because, parents work, life gets in the way, and it's not always convenient to, take the time out. So they will transport 8 to 12 of those students on the school bus with parent permission, of course. And our dedicated staff members will have a time slot of approximately 3 hours, and we'll do any and all services that we can do during that time, and then they are transported back to school.
So that is just a beautiful thing.
And that's a wonderful thing because one of the main issues that we have noticed, and we've been around since 1954, so we've been around a long time. So one of the main things that we've noticed is there is an issue with access to care. Access to care, especially in rural areas or in underserved areas, that is a big division for a lot of people, not only in dental, but also in health. It's a big issue. So providing that transportation for these students, which a little bit over 83% of our students are bused. They are not brought in by parents. It's a game changer. It's a big deal. And we thank Kanawha County Schools for that partnership. We do.
Yeah, it's just huge.
Yeah,
Transportation
it is
not always
access
as
to
easy.
care. That's what it's about.
Yeah, I love that.
Yeah.
So we mentioned your partnership with Carver. Felicity, you are a great example of that.
Yeah.
And I'm so happy you're here. Tell me how you got involved in this program.
Well, I was doing the dental assistant program at Carver while attending Capital. And then we did OJT, which is on-the-job placement. And I reached out to them and started doing my training there, and they offered me a job afterwards.
Wow. So you're in college part of the time.
Yeah.
And then getting on-the-job training. OJT, if I'm
Yeah.
going to get that lingo down right, OJT. And that's just going to make you an even better dental hygienist. And I bet your patients love you, don't they?
Yeah, I love them too.
Yeah, that's so fun. I'm so glad that you get to do that. And you're in the clinic how many days a week?
Just once.
1 day a week, and
Yeah.
classes the other days.
Yeah.
Oh, congratulations. That's
Thank
just
you.
really, yeah, that's so great for your career.
Thank
I'm
you.
glad about that. So you're busing kids to school, you're doing OJT for Carver students,
Yeah.
but there's so much more.
There is. It's not only just the dental treatment that we provide, but it's also the oral health education that we provide. And again, that goes to our partnership with Kanawha County Schools. We provide all of the oral health education for the elementary school, middle school, and high school students. That includes kindergarten roundups, pre-K roundups, screenings. We also do any type of oral health education as far as nutritional counseling, oral health, just awareness. We do athletic night guard programs. We do athletic night guard or mouth guard programs. We also do expectant mother programs. So it's all about maternal health and baby health. They're smoking cessation, all of that. It's all involved in oral health because oral health is linked to your overall health, and it's very important. We do approximately 600 programs a year, and usually have anywhere between 11 and 13,000 participants in those programs.
We were laughing earlier because when I was in school years ago, and remember, it was the little red tablets that you chewed, and they showed you where you didn't brush your teeth, and we were just all amazed at what was happening. But it is a bit more than that.
There's so much more now. There's so much more now, with nutritional health, athletic health, with expectant mothers. Chandler has a wonderful expectant mother program that we partner with. Vaping, smoking cessation, smokeless tobacco. There's a lot that's involved, and also, with your overall health, with diabetic counseling, anything that can be related to your overall well-being.
Yeah,
Mhm.
just so great that you're teaching this information early.
Right, and I'm so glad that you asked us to come this month because February is Oral Health Awareness Month.
Wow, I wish I could say I
yeah.
knew that. That is a great coincidence on my part.
Yeah, so we've been busy this month. We do a lot of programming this month because it's Oral Health Awareness Month, and it's one of our times to shine. So
Well, I think you shine
yeah.
all throughout the year.
Thank you.
And speaking of throughout the year, so the typical school year is what, late August till early May.
Yeah, our year runs July to June. So that's what our calendar year runs, July to
Okay.
June. Mm-hmm.
So there is somebody available
Year round.
because there are
Yes.
year-round schools.
Yes, there are year-round schools, and so our outlying clinics are not always open year-round, but our main clinic at Mary C. Snow Westside Elementary is open year-round, so we are always available to provide services for anyone that we need. And if there's ever any type of dental treatment that is beyond the scope of what we can do here, and we have very talented dentists, dental hygienists, and dental assistants that work with us. We also rely on our wonderful community partnership with the dentists in the Kanawha Valley. We could not do what we do without them. And I think that's what sets our program apart, is how supportive our local dental community is of our program. Oral surgeons, orthodontists, pediatric dentists, root canal specialists, they have all been very generous with helping, and I cannot remember a time when I've been told no, when we reach out to them for help.
So not only are the students getting cleaning and somewhat routine care, they have the advantage of your
Right.
program to be
Right.
hooked in with something else that they need.
Right. There have been times, and I've been with the program in June. It'll be 17 years. So there have been times when we do provide life-changing and sometimes life-saving, intervention. Because if you've ever had a dental issue or a toothache, you'll know that there's nothing like it. So it's
It
very
hurts.
difficult to concentrate in school.
Right. When you're, it hurts. Who wants to pay attention?
Right.
When all you can think about is that your mouth hurts.
Right. Right.
And then you're not eating and you're not sleeping and it just snowballs. So
Right.
you really are changing lives
Right.
with the help that you're giving the kids.
Right. Thank you. Thank you.
Yeah,
Well, it's
absolutely.
actually a privilege for us. It's a privilege for us because we get to meet people like Felicity, and we get to impact children's lives, and there's proof that our program works, because when you've been with the program as long as a lot of our employees have, you see these children from elementary school age to high school to graduation, and it's proof that our program works. So.
Now, so you bring up a really good point, and it kind of ties into something that we were talking about off camera, that if you're working with a high school senior, and perhaps it goes right past the cleaning, or they need a little more care, you see them through.
We won't turn them away. Yes.
So
yes.
they may graduate, but you're going to see them through
Right.
the care they need.
If we have a student that we see right before, technically, once you graduate from Kanawha County Schools, the eligibility is not there. But if we see you in your senior year and you have some needs, we're going to finish those needs for you.
Yeah, just really, it's quite special.
Thank you.
Tell me what else I need to know about the program.
Well, we are here, and we are here for anything that anyone would need. And even if there is an adult that maybe doesn't qualify for our services, or a recent graduate that doesn't qualify for our services, we will direct you in the right way. We just want everyone to know that we are here, because there are often times that people say, I didn't even know this service was available. And so that's just getting the word out there and knowing that we're here for our students.
Right. So ways that people can learn a little more about your program, they can call you.
Yes.
I think we have that number on screen, which
Yes.
is 304-348-6613.
Yes. Yep.
They can visit the Kanawha County website, Kanawha County Schools website.
Yes, if they go to Kanawha County Schools website and you click on the Health Services link, we are part of Health Services. So just go to the dental link on Health Services, or we also have a Facebook page.
Facebook page, of course.